tonight. Farah Nasser.
Good evening, and thank you for joining us. 4 weeks to the start of school, and this year, it's not the kids with the stomach-turning anxiety, it's the parents. No matter where you are in this country, if you have children, it's likely a daily worry and a topic of conversation. Many experts have said school is needed for a child's mental health, but some parents fear reopening could risk their physical health with an increase in COVID-19 cases. In Canada, 9,500 cases have been recorded in children under the age of 19. That accounts for 8.1% of total COVID-19 cases in our country. 26 children in Canada have been admitted to the ICU. One child, a girl, has died from the virus. There is no question. How schools roll out this unprecedented plan will impact transmission rates among children and adults. Today, British Columbia officials announced the start of the school year is going to be delayed to allow teachers, administrators, and staff to be together and to understand CDC guidelines before the learning begins. Heather Yourex-West now with some key logistical questions about getting back into the classroom.
This classroom is part of a photo op from the Alberta NDP, but it illustrates the concerns of parents across the country.
My daughter's also very anxious, the one that's going into grade 7, simply because they're not sure what they're going to have to face with 30 kids in the classroom.
We maintain that physical distancing is one of the key layers of protection in a school context.
Federal guidelines have called for schools to reduce the number of children using one physical space at the same time. But as back-to-school plans emerge, few provinces have committed to reducing class sizes. Ontario is maintaining its pre-pandemic rule, requiring the average class size within a district be less than 25. Other provinces have opted to create learning cohorts. Quebec bubbles are capped at 25. It's 75 in Manitoba, 60 to 120 depending on grade level in BC. Nova Scotia has only set a class size limit for preschool children. That's 15, while Alberta and Saskatchewan have no class or cohort size limits in place. Elsewhere, countries with large class sizes have seen the virus spread quickly after schools reopened. In Israel, where some classes had up to 38 students, hundreds of schools were forced to shut down after more than 900 people became sick. A stark contrast to a country like Denmark, where classes of 20 were further divided into smaller pods. After 5 weeks, that country saw no increase in COVID-19 spread.
If we keep the community numbers low, the risk to the school drops exponentially. The real problem is if there is a high number of virus in the community, the likelihood of a child bringing that into the school, unfortunately, then goes up. And once it's in those tighter environments, it can spread quite rapidly.
Which is exactly why so many parents are struggling with what to do this fall, worried that sending one child back to a crowded class could put entire families at risk. Heather Yourex-West, Global News, Calgary.
Many kids have already gone back to school in the United States. And tonight, there is some alarming new data that shows coronavirus cases in that country have spiked among children recently. The report published by the American Academy of Pediatrics and Children's Hospital Association shows 97,000 kids were infected with COVID-19 during the last 2 weeks of July. That's a surge of more than 40%. Since the beginning of the pandemic, more than 330,000 children have tested positive across 49 states, making up nearly 9% of all cases in the United States. Experts here say it's highly unlikely Canada's going to suffer the same fate because our community transmission is much lower. But as Jackson Proskow reports, parents in the United States are wondering if schools are a safe place for their kids.
Just days into the new school year, students are already back out of the classroom in parts of Georgia. At least 9 students tested positive for COVID-19 after pictures emerged of packed hallways and few masks. Hundreds are now quarantined.
We saw they weren't socially distanced. They did not have masks on, and both boys sat in classes all day long.
Parents in state after state are wondering, is it worth the risk?
Walking into the school, I didn't see a lot of mask wearing. And I think that should have been something that was mandatory and not optional.
In Kentucky, the governor postponed plans for in-person learning as cases surge.
Getting them back at the height of the pandemic, I think, would be irresponsible.
There's a tiny fraction of death, tiny fraction, and they get better very quickly.
But President Donald Trump keeps pushing back. He's not a doctor, but he insists that children are practically immune.
They don't catch it easily, they don't get very sick, and according to the people that I've spoken to, they don't transport it or transfer it to other people.
That's simply not true.
Those younger groups played a role in transmission more broadly, and I'm worried that we're going to see disease spread throughout the age range.
Especially with the pandemic still raging. College sports may be the next casualty of the virus, with parts of the football season canceled or postponed.
There's a lot of reasons to not play, and for the overall health and safety, I think it's important not to play.
The number of daily new cases seems to have stabilized for now, but at a rate far higher than in any other country. More signs the virus is far from contained in the United States.